I'm going to do something a little different this time and talk a little bit more about what data we're looking at as we look at the pandemic in the United States and in our region and in Idaho in particular. So I'll walk you through some of the data we look at and then finish up with some of our metrics. So to start, I want to just draw your attention. I know many of you are aware of this site, but we look at this one very regularly. This is a Brown School of Public Health site, and it is showing data based on the Harvard Global Health Institute, the Rockefeller Foundation, and other partners that have created a risk categories. Now, we're all familiar with the risk categories that our local public health districts put together, which help guide school opening and school closures. And this is similar, but this is the national way of comparing risk in Idaho County, say, to a county across the border in another state. So they use the same metric, and they just rely on the daily cases per 100,000, and they've divided counties and states into 4 categories based on that. So here, for example, is where we sit now in Idaho. We are the 7th highest risk level if you look at the state as a whole. And this shows it by county, and you can see it's not evenly distributed throughout the state. And we'll talk about that in a little more detail later. But I think the thing that hopefully strikes you in this map is really it is the central part of this country right now that is getting hit hardest by this pandemic, with areas in the Northeast seeming to have been able to reduce their numbers greatly. Several states in the Northeast really doing the best, but also parts of our neighbors to the west seeing lowering rates. Next slide. So this map just takes those numbers and looks at a state level risk versus county by county. And I think it shows even more clearly the high risk states that right now with the hardest hit as we see it in the central part of our country, including 3 of our next door neighbors, as it were, bordering the eastern part of our state. Just honing in a little bit, I wanted to show you, as I know you're all well aware, right now it is the southeast part of our state that is getting hit the hardest. And so just looking at what's going on across the borders, and you can see there that counties that align where the risk is great, just across the border in Wyoming, parts of Montana. Next slide. And you can see there also Utah, where their rates right now, their statewide rate is very similar to ours. And you can see there some across the counties that border each other having similar high risk levels. To our west, both Washington and Oregon, who initially, especially Washington State, of course, got hit very hard, but they're starting to see decreases throughout the state. Although we have one county that we border where they continue to have high rates as we do. I want to turn our attention now so this is on the left, continued information from that website we've been looking at all along, which is globalepidemics.org, and you can see there they have, the website is on the slide for those of you that are interested in looking further. But on the right, you can see the data that we have on our website, and I want to make sure you're aware that you can go onto our website and see not only cumulative cases by county, you can see rates by county, you can see the last 7 days, and it shows you not just the current snapshot, but a trend over time. The trend that you're seeing right now is the 7-day average, the case rate over the last 7 days, and you can see that the very right part of the slide is cut off, at least in the view I'm looking at right now. But go on that website. You can sort those columns also if you want to see which counties right now are getting hit the hardest, which counties have had the most total cases, etc. So it's all right there. Next. We also have been looking very much, a lot of discussion, of course, about schools, the impact of school openings and reopenings. How is that impacting our communities right now? And what you'll see here is that if we look at our cases by age group, it really brings to light and highlights that really starting about midway through this pandemic, you can see there that the age group of 18 to 29 years of age is that yellow line way on the top there. And you can see that the rates in that age group are far higher than other age groups, kind of aligning with some of the concerns that we've heard from around the state, colleges and universities having high numbers of cases, communities trying to work with the colleges and universities to see how can we bring those numbers down. But it's not just kids in colleges and universities. We all recall over the summer how we had some outbreaks related to bars and restaurants and other things. So I don't want to just put the blame on the colleges or the universities. I think they're working very, very hard to try to bring their numbers down and to work with their students to reduce this. But we're just seeing across the board in this age group our highest rates. Dropping down, the next age groups that have the highest rates and the sharpest increases are adults, middle-aged adults in their 30s and 40s. So again, it's not just the young folk, but we really are seeing that the greatest rise in that population. So I want to move into hospital data, and I'm going to wrap up in hospital, talking a little bit about that and kind of set the stage. So just briefly, this is on our website, and you can see here the top chart is the number of people hospitalized with suspected or confirmed COVID. Hospitals are reporting this data into a federal website every day, HHS Protect, and we are able to pull that down daily. So you can see there, we do give it a couple, you'll see the last date we have displayed as of today is from the 12th, because some hospitals, there's a little bit of a lag until all hospitals have their data entered. So the last date we have there is October 12th, and you can see 219 Idahoans currently in the hospital, and we have 56 Idahoans currently in intensive care, according to the hospital's own reports. So which leads me to the metrics. I won't go through all of them, but suffice it to say that the hospital data is, again, where we're struggling, and we are very concerned about the rising number. This data shows new admissions on a daily basis, and so you can see here, we would like to see fewer than 8 per day admissions, and as you can see here, we are well above that, and the numbers are rising. And lastly, the total number of patients hospitalized in the ICU, and you've already seen this data because it's on our website, is greater than 25 per day, well over that. Again, I mentioned over 50. So until we see these numbers improving, we don't feel that we can move out of stage 4. We think it's important that we continue to work very hard as a community. As the governor emphasized, these folks are the ones that are getting the brunt of it. Most of us, if we get COVID, will probably not get severely ill, but we need to do everything we can to protect these people, especially people with underlying health conditions, seniors, people who are vulnerable. We want to keep that virus from getting to them. This is a very contagious virus. We need to do everything we can.